Hello, good morning everyone. I'm Dr. Akhil Tawari. I'm a dual fellowship trained adult and pediatric spine surgeon. And today I'll be discussing on a very common yet probably misunderstood topic of slip disc, also called as ruptured disc. So I'm sure everybody might have heard or probably unfortunately suffered from this common problem. Without further ado, let's begin to try to understand what exactly is slip disc. Coming to the anatomy of our spine, if you pay attention to this model, we have these bones, and in between the bones we have these jelly-like materials which are called as disc. Now these discs are similar to car tires. So if the tire is good, car is good. But if for some reason the tire is punctured or there is alignment problem with the tire, then our car becomes wobbly. If you pay attention, this is how a normal disc looks like. So you can see that it's nice and juicy and the nerve is completely free. However, if for whatever reason, if that disc kinds of juts out, it starts impinging on the nerve. This problem is called as slip disc because the disc has slipped from its position. When it goes and pinches the nerve gets irritated and distributes pain along its distribution, which is then called as sciatica. The patients usually present to us with back pain or any pain that is shooting down their legs. So the patients would come and say that there is an electric shock or there is some burning sensation, especially in one leg more than the other. Minority patients also complain of weakness in their legs, especially difficulty in moving their toes, foot or ankle, and their mobility is severely restricted. So that's how we come to know that probably there is something that is wrong in the spine. When patients come to us, we first like to do a physical exam. So we like to see how their overall neurological function is. If there is any weakness in the legs, there are special tests that we subject the patients to do, which tells us whether the nerve is irritated or not. Going forward, we like to do investigation. We start with x-rays to know whether the alignment of the spine is good or not. But more often than not, if the patients continue to get pain, we end up with the diagnostic imaging modality of choice, which is an MRI scan. MRI is extremely sensitive as well as specific, and we are able to not only diagnose the level which is getting affected, but also come to know how much that nerve is pinched. And usually that is our go-to test for diagnosing this condition. Now, suppose there is slip disc. So what next? So what next is majority of the patients get better with conservative management. If you ask me a percentage, more than 90% of patients, they get better with conservative management, which essentially involves taking rest for 3 to 5 days, taking medications in the form of anti-inflammatory drugs. Sometimes we also like to give opioid medicines for pain relief. And there is a good literature of giving patients an oral Medrol dose pack, which is oral steroids to calm the nerves. But there is a deadline or a timeline to which a conservative treatment can be persisted. If suppose the patients continue to get pain beyond 4 to 6 weeks, then we start discussing about the other modalities of treatment. One such powerful modality is taking cortisone shots. So that essentially is calming the nerve by injecting a local dose of steroid and local anesthetic around the inflamed nerve. This is a straightforward procedure in which the patient is taken into the operation theater. We isolate the nerve with the help of a dye, and then we inject the steroids around that nerve. A percentage of patients do get better with local steroids. However, suppose with regards to timeline, if the pain or the symptoms persist beyond 6 weeks, or there are neurological issues to the extent that patients are unable to walk even for a minute, the patients have weakness, if the patients have lost control of bowel or bladder, which can be catastrophic, in that scenario, we have to consider surgical intervention. The aim of surgery is to free the nerve there are different ways by which this surgery can be performed. So in the good old days, there were conventional discectomy surgeries via an open incision which was performed. But now we are moving towards doing minimally invasive surgery, which can be either a microscopic or an endoscopic discectomy. The end result, irrespective of the discectomy surgery, is to remove the damaged portion of the disc and to free the nerve. Once we are able to achieve this objective, majority of the patients get better. Thus, as we say it, surgery is usually the last resort, and we fall back to surgery when conservative or injection modalities fail. Now, let's talk about the preventive aspects. So, who gets slip disc? So, there is a genetic predisposition, no doubt. However, we have seen that extreme levels of activities. So, either you have a sedentary lifestyle wherein you are majority of the time sitting in front of the PC or sitting at home and not doing a lot of physical activity, or if you do extreme activities such as doing deadlifts without a good form or posture, or traumatic events can lead to acute slip disc. Hence, maintaining a reasonable physical activity, avoiding smoking, going for regular walks, avoiding one particular form of posture more than 30 to 45 minutes can go a long way in preventing slip disc from happening. And also, if a slip disc has already happened, these are usually very good ways by which further attacks can be prevented. Physiotherapy also has a good role in maintaining a good form, posture, strengthening your muscles so that they offload your disc, and is highly recommended as a part of the conservative management for patients. Going forward, if patients develop slip disc, there are some red flags that I want everyone to be aware of. So if you have back pain, but the leg pain is so severe that you are unable to walk, there is weakness in the leg, if there is bowel and bladder involvement to the extent that you are not able to control your bowel and bladder symptoms, that is a red flag. I don't want you guys to take it lightly. Please go and see a spine surgeon at the earliest.